Welcome to the Expert Series, brought to you by the Lupus Foundation of America. Our speaker today is Dr. Hazel Breland, Associate Professor of Occupational Therapy at the Medical University of South Carolina and Director of the Raymond S. Presidential Scholars Program. Dr. Breland is also President of the Association of Rheumatology Health Professionals, which is a division of the American College of Rheumatology. Today, Dr. Breland will be sharing more information about exercise and lupus. I would now like to turn it over to Dr. Breland and thank her for joining us.
Thank you for the opportunity to talk about exercise and lupus. My goal today is to provide an overview of key terms, my perspective as an occupational therapist, steps to consider when planning or continuing an exercise routine, and discuss available reputable resources about exercise and lupus. I'm excited to share this information, and I encourage you to personally reflect on your life as it relates to exercise and lupus. When thinking about where to begin with this topic, I decided that it would be important to first define physical activity, physical inactivity, and exercise. And I think these three terms are important for people to have an understanding of what they mean as they think about living with lupus and exercising. As an individual with lupus, you may have been told you need to be more physically active. The World Health Organization defines physical activity as any bodily movement produced by skeletal muscles that requires energy expenditure. Now ask yourself, what do I do for physical activity? The next term is physical inactivity, and we all have a good understanding of what physical activity is. It is the lack of physical activity. So now you must ask yourself, am I physically inactive? And the final key term that I want to talk about is exercise. And exercise is a subcategory of physical activity that is planned, structured, repetitive, and purposeful in the sense that the improvement or maintenance of one or more components of physical fitness is the objective. So the final question you have to ask yourself, what do I do for exercise? So next, I want to talk from my perspective as an occupational therapist. As an OT, I accept people as they are with regards to their personal context, their culture, and what they view to be their life's purpose, and anything that makes them who they are. My professional organization, the American Occupational Therapy Association, endorses the belief that as an OT, we serve our clients so that they can live life to the fullest. Occupational therapists work with individuals with lupus by providing personalized services that strive to promote health and prevent disability. So I want you to think about that health is defined as the state of complete physical, mental, and social well-being, not just the absence of disease or infirmity. And so individuals with lupus are encouraged to participate in physical activity and exercise to improve their physical, mental, and social well-being. As an OT, individuals with lupus can adapt what they do for their daily activities to prevent or minimize symptoms and to develop a healthy lifestyle. So what I mean by that is we're looking for individuals living with lupus to work with an occupational therapist so that you can really do those things that you want to do, but doing those physical activities, doing those exercises to prevent or to minimize symptoms, also while thinking about developing a healthy lifestyle. So when you think about exercise, really, I want you to think about, am I ready? How do I get set? And how do I go? How do I get to the place where I'm actually engaging in exercise? So one of the things I want you to think about is before you do anything, you have to be mentally prepared. And so you have to think about exercise and really think about what you want your exercise routine to look like. What are you prepared to do? So begin to think about exercise. And then secondly, I always encourage anyone who is beginning or changing their routine around exercise, to consult a physician. You want to find out what is your health status prior to beginning an exercise routine. Are there any health concerns that you have that you want your physician to monitor before you begin an exercise routine and during your exercise routine? And then you must consider your assets and your barriers. And let me tell you a little bit about what I mean as your assets and your barriers. Where would you exercise? Do you have an exercise facility in your neighborhood? Do you have an exercise facility in and around your home? Or do you really have the resources that you need? If you don't have those resources in your community, can you join a gym? Can you afford a personal trainer? Do you have the clothing and the shoes that you need to exercise? Is your community set up in a way that it is exercise friendly? But you may have some barriers. Cost may be a barrier if you don't live in a neighborhood where exercise is perceived as an important activity, and now you don't have safe walkways to walk on. There are not biking paths. There are not walking trails. Other barriers to keep in mind is there a cost restriction? Is access limited to you? So those are the things that I mean. You think about your assets, those things that will help make it easier for you to begin an exercise routine, and then those things that may be a challenge for you to begin an exercise routine. And not just to begin, but to continue an exercise routine. So that's what I mean by ready. Prepare mentally, consult a physician, and consider your assets and barriers. The next step is set. You want to set realistic and meaningful goals. And again, that goes back to you being prepared mentally. Are you thinking about exercise to improve your cardiovascular health, help your heart function better? Are you thinking about exercise to reduce some of the symptoms that are associated with lupus? Are you thinking exercise because you have a goal of trying to trim your waistline, trying to be more flexible, trying to be balanced? But you are the only one that can really think what is realistic. And when I mean realistic, can you achieve the goals that you set for yourself? Can you stick with those goals? And what is the personal meaning that you attach to those goals? Because if your goals are not realistic and meaningful to you, it's unlikely that you're going to be moving on to the go step. And when I think about go, you're now focused, you're committed, and you're ready to exercise. And in being focused, committed, and ready to exercise, there comes some motivation from within that's necessary. There comes some need for accountability, and there definitely comes some need for support. You want to make sure that you're focused on your exercise goals, you're committed to your exercise routine, and the exercises that you're doing are helping you to feel better physically, emotionally, and socially. Next, when you look at this slide around exercise and lupus, there are a lot of words on the screen. This is actually called a wordle. It's just a word picture. And when I put this slide together, I really wanted you to be able to see words that jump out at you relative to exercise and lupus. And so I really want to sort of start in the middle and work my way out. Some words are larger, so they stand out. They're different colors. But I just want to sort of walk us through this. I put it together to sort of give you some tips about types of exercises to do, reminders of things you want to keep in mind related to living with lupus and exercise. So you manage your lupus every day, and there is evidence and research to show that exercise is an effective way to manage your lupus. And so in saying that, you may ask, well, how is exercise going to help me manage my lupus? Specifically, we're talking about exercise, so aerobic exercise. Aerobic exercise helps to work on your cardiovascular factors, and you want to think about something that's going to be low impact. Exercise makes you to become more aware of your body. It helps you to focus on your coordination. It's intended to make your muscles stronger, to reduce stiffness. It's also intended to have you think about other activities or, specifically exercises that could include flexibility stretches. You could do yoga. You can do Pilates. Anything in the water that's going to help protect your joints, that will also help to reduce some stiffness. If you're in a pool that is warm and heated, that is a good place to work on your stiffness and to work on reducing impact of your joints. You want to make sure when you think about exercises that you're really thinking about being flexible. You want to work on your coordination. You want to work on your balance. And so the point of exercise is to help you to reduce some of your symptoms around lupus, keep you from being deconditioned, but you also want to make sure that the exercises that you choose, that they're enjoyable to you, that you're going to be motivated to do it, that they're going to help your well-being. And again, I talked about your physical, your mental, and your social well-being. You want to start to develop habits around exercise that will allow you to develop a healthy lifestyle. You want to make sure you're thinking about how it can reduce your fatigue. But you always want to make sure that you are thinking safety. You want to make sure you're exercising in an environment that is safe. You want to make sure that the exercise that you're doing, that it's not hurting your body, and that you don't feel defeated when you start exercising and the exercise doesn't give you the immediate result that probably should be a long-term goal rather than a short-term goal. Because again, you want to make sure that your goals are realistic and meaningful to you. So to sort of summarize, think of exercises that are going to keep you motivated, that are enjoyable, that allow you to feel some sense of accomplishment, and that it improves your well-being. You're going to be safe, and it affects your overall quality of life. So again, exercise needs to be repetitive. It needs to be purposeful, and it really needs to think about giving you a sense of improvement for improving your overall well-being. So now I'm going to move on to the next slide that looks at evidence-based take-home points. So when you think about what is the evidence behind exercise for people with lupus, there's research that shows that exercise alleviates fatigue in individuals with lupus. And at the bottom of the slide, there are a number of references where you can actually find out more about what I'm saying. Additionally, exercise can help reduce cardiovascular risk factors. So people that have lupus, you want to make sure that you're thinking that the exercises that you do can help improve your cardiovascular function, how your heart is working, and how the blood is flowing through your body. And then, again, earlier when I talked about your assets and your barriers to exercise, and I talked about being safe when you exercise, some people have found that home-based exercise routines, specifically thinking about some of the gaming systems that are available on the market, such as the Wii Fit, is a good way to begin an exercise routine. I was a part of a research study that looked at a home-based exercise program for 10 weeks for people who have lupus. It was a small pilot study, and the results after the 10 weeks of the individuals exercising in their home with some very personalized exercises, that they reported that they enjoyed exercise. they reported that there were some health benefits. And the health benefits that they saw, it reduced their fatigue, it reduced their weight. Some people had a reduction in their waist circumference. They were less anxious. Their anxiety levels were down. And then their overall pain rating was decreased as well. So they enjoyed it. They had some health benefits. They had a sense of accomplishment for reaching their goals. It was convenient because it was in the confines of their home. And they were able to personalize the exercises. Now, you have to keep in mind that we all have different levels of physical function. And so where some people who are living with lupus may be able to be more vigorous in the types of exercises that they do, you have some people that may not have that same capability. So some people may be still able to participate in sports, to bowl, to do some more vigorous activities, but then you may have some people who need to revert to trying to maintain their physical function and their fitness by doing yoga and doing Tai Chi and Pilates, which are less taxing on the body, but they're still providing a benefit to an individual. And so I'd like to thank you for your time as I go into this last slide that will provide you with some exercise resources. And as a healthcare professional, I want to always encourage people who are living with chronic conditions such as lupus to think about going to resources that you know have your best interest. They're reputable, they're providing sound information, reliable information. And so I've shared with you 2 resources for you to find information about exercise. And I would like to thank you again for your time.
Thank you so much, Dr. Breland, for joining us today. We really appreciate all of the information that you shared about exercise and lupus. For those listening in, we invite you to check out next month's presentation on monitoring lab tests and blood work for beginners. If you would like to learn more about living well with lupus, you can find additional resources on the National Resource Center for Lupus, or you can call one of our health educators at 1-800-558-0121. If you would like to connect with others who are impacted by lupus, check out our online community, Lupus Connect, where you can talk with others, find emotional support, and discuss practical insights for coping with the daily challenges of lupus. Thank you, and have a wonderful day.